So today we're going to talk about headaches. What certain types of headaches. There's so many different types of headaches that people can have. So today we're going to focus on two different ones. And the first one we're going to talk about is cervicogenic headache, and what a cervicogenic headache is. Cervicogenic, most of you probably have never heard of that word. It just means basically it's coming from the spine. It's coming from the cervical spine, and that's where the main problem is coming from. How do we deal with the cervicogenic, or why is it causing us problems, and why is it making our head hurt? Well, there's a lot of explanation into why that happens, but there's nerves that come from the cervical spine that actually go to the head, and that can cause some pain signals that go back to the brain that says your head hurts, when it's actually not necessarily your head. So with the cervicogenic spine, this is very common in people that have recently been in car accidents or have had whiplash injuries. It's because their neck has become kind of a problem. You've hurt some of those joints, you've hurt some of the area, and that is sending pain signals out and causing those headaches. So how do we take care of these cervicogenic headaches? Well, there's several things that we can do. One, you'll notice most of the time when you've got these cervicogenic headaches that you can't move very well. Your neck, it hurts to move certain ways. You feel like you can't move as far anymore. So what do we do? Well, we've got to break up those restrictions. We've got to help you increase your range of motion, which will help you to not have these headaches anymore. So we're going to adjust the neck. Well, yeah, that's scary for a lot of people to have their neck adjusted, but it really isn't. This is not the movies. We're not going to break your neck. We're going to help to break up the inability to move. And how we're going to do that is we're definitely going to need to work on those muscles to help you relax, to help deal with the tightness that are in those muscles. And so by dealing with the muscles and getting them to relax, we're able to better move the neck and to get rid of those restrictions. For many people, these headaches are a big problem and prevent them from doing a lot of things in life. And so what they end up doing is they take medications on a daily basis because they don't want to deal with the pain of the headaches. It's usually over-the-counter stuff, the ibuprofen, the Advil, Tylenol, whatever pain medication they like to use. The problem with the NSAIDs is that it will eat your gut. It will take the acid off. It will destroy the layer, and so what happens is a lot of people will get ulcers or bleeding if they're constantly using these pain medications. There are times when pain medications, ibuprofen, are okay, but it should never be a daily basis kind of thing where we're taking a very high dosage. And so a lot of people have problems with internal bleeding because of overuse of medications, the ibuprofen. So by coming to see us and dealing with the headaches, and rather than trying to hide the pain, we actually try to deal with the problem and fix the problem. And so these cervicogenic headaches are very easily fixed. The muscles that are sore, you got your sternocleidomastoid, your suboccipital, which sits right here in the back, your pecs, your traps. All these things become very tight and sore. Sometimes we'll be in spasms, especially after a car accident. Tension headaches are that. There's tension built up, which is causing some of those headaches as well. So same places, really. You got your suboccipital is huge. It's very, very tender and very tight on a lot of people who have tension headaches, as well as the tension that they keep in their upper traps. And another reason is because we sit at computers all day. We sit in a very poor posture. We're always sitting, hunched over on the keyboard, typing, and that causes a lot of problems because of that poor posture. So our head comes forward, which puts undue stress on certain joints in the neck that aren't supposed to have that much weight. And so by improving our posture and by bringing our head back, shoulders down, all these things, and working on strengthening certain muscles that have become weak, we're able to deal with these headaches very easily. I had a patient who had headaches for 30 years on a daily basis. And after a month of taking care of him, we got it down to once or twice a week, maybe, and no more medications. And that was a huge blessing to him that he didn't have to do that anymore. And then over a little bit longer time, we got the headaches to disappear, maybe one every couple of weeks. It was really amazing to see and how we could affect his body and teach him how to take care of himself. That is what we're going to do here at Dodds Chiropractic. I'm going to take care of you. I'm going to teach you how to take care of yourself as well, so that you know how to fix the problems that you have. And so I hope that you have a desire to come in and get these headaches taken care of, because headaches are not a normal part of life. They're not. I don't have them. There are a lot of people that don't have them, and you're not supposed to have them. And so if you do, there's a problem, and there's things that we can do to take care of them. So I hope to see you come in, and so we can help you with your headaches.